So really pleased to introduce a friend and colleague of mine, Professor Chris Peach, who is at Manchester University Hospitals. He is an upper limb expert, shoulder and elbow expert, working out of Manchester University Hospitals and the Author Team Centre. As we know, really sad news for Alun Wyn Jones and the Lions team, an absolute colossus in rugby. And we saw that injury earlier that we hoped wasn't as severe as it was. And it looks as though it was a shoulder dislocation, and that's put him out of the tour. Tell me a little bit about what happens with a shoulder dislocation.
Yeah, Justin, it's a complete nightmare for, going off on the tour tomorrow for him. Yeah, so it's a big blow for the Lions. So the shoulder is the second most common injured joint after knees, and we see a fair few, particularly up in Manchester in the rugby league belt. And actually, it was quite interesting seeing your footage on Twitter, because it's quite difficult to pick out exactly.
Can we go to that video?
Oh, yeah.
Can you see that?
Yeah. So this is what we see with a direct lateral blow type injury. And if you look at it, so this is different from those injuries where your arm's in abduction and external rotation. So his arm's very much internally rotated. If you go back towards the beginning of the clip, you see him start to plant his hand.
Yeah.
And it really just comes into internal rotation as the opposing player, I can't see who it is, hits him.
Yep.
So these are different from our try-scoring type injuries or external rotation tackling type injuries, where the shoulder actually dislocates often posteriorly. If it dislocates, all these players come off and say, I don't know what happened, but there was something happened and I couldn't carry on the match.
So this is the Muscle Pro 3 app, which is a really useful app. So just to let people know we talk about these different dislocations. So just explain the anatomy of the joint here.
Yeah, nice pictures. So you've got very much a ball and socket joint in the shoulder. The major difference between the socket of the shoulder, unlike the hip, the socket is essentially made of bone, and so you have these rotator cuff tendons that support the shoulder and are dynamic, but they rely also on the capsular labral complex. Yeah. The ligaments or the bumper around the socket and the lining of the shoulder joint.
So the labrum, if I join, so the labrum sort of comes on around
the edge. Yeah, that's right. Yeah. So and that gives not only a little bit of support, but also gives proprioception for these supportive muscles to fire up. And in this particular injury, the humeral head's probably been driven backwards, and it looks like he's probably dislocated posteriorly, which is more unusual, but not uncommon in rugby.
So backwards, but we mean it's gone. So here's the front. So it's gone back in that direction. And you mentioned the rotator cuff as well, and I can put these on. So just to explain that these are these muscles that, as you say, grip around the humeral head and add that stability there. Do these tend to get damaged or injured as well in a dislocation?
Yeah, so we rarely see rotator cuff tears in dislocations unless you're much more elderly, sort of 50s, 60s. But actually, in the rugby players, we do see a higher degree of rotator cuff tears, particularly in elite rugby. So when he's got the shoulder back in joint and is going through his scan, that's certainly going to be something that the team will be looking at.
And that's something we were discussing earlier. So from you as the orthopedic surgeon and my experience as the team doctor, the thing we want to do is assess the injury, make sure that shoulder is the limb is back in its socket, that the joint's back in its socket, if that's safe to do. So that's one of the priorities of the team doctors and the tunnel staff. So once we've established that and ideally established the an injury, they'll come and see someone like you in those early stages. What happens in those first few days?
Is get it to settle down, get the swelling to settle down, get the pain under control, and then establish exactly what the injury is. If he's got a posterior labral tear or a glenoid fracture, so he can sometimes fracture off a little bit of the socket, or a rotator cuff tear.
Let me just go back to that, Peachy. What do you mean by you said the glenoid fracture?
So most commonly the shoulder dislocates by just sliding out of joint, tearing the soft tissues around it. But sometimes it knocks it out with such force that actually it bashes off the lip of the socket. So either as you say, as an anterior dislocation will bash off the front lip, or a posterior dislocation, the posterior lip. And that's a more tricky injury to treat surgically. Although actually, in my experience, some of the patients do a little bit better, and it's a little easier to follow what is essentially a fracture than a soft tissue injury post-operatively.
Now, we don't know what injury that Alun Wyn Jones actually had, but we know that it must be significant enough that they've called him and said he can't go to the tour, go on the tour. Is there any circumstances where someone has a shoulder dislocation in that way and they can get back to playing within a few weeks, and why not?
Yeah, it's pretty rare, and it often depends exactly what part of the seasons they're in, and what are their goals for the rest of the season as to how far you push that. But it wouldn't be unreasonable to get it to settle down, what it will be a muscular injury as well as the soft tissue injury within the joint to settle down, and then see how they get on. Whenever they're strength training, they get soreness on bench pressing, overhead lifting, all of the sort of typical strength training that the rugby players do. If you get them into that program, it's not unreasonable, but I think it's very unlikely you get many players back.
What sort of time? So a dislocation, shoulder dislocates, typically for a professional athlete like a rugby player, how long would it take normally by the time they've seen you, had a repair, before they're back in full contact play and full sport again?
Yeah, it's normally 4 to 6 months. It's variable. Probably at the earliest 3 months, and it probably depend on some of the injury factors, tissue injury was, and how well the player rehabs. These are kind of your average times, but very much the club rehab team are working with the player, not getting them back into contact training until at least 3 months, looking at how well they strengthen up.
And why is it 3 months? What are you waiting to heal and repair? If you've repaired it and it's all stuck down again, why can't you just go back into contact?
Yeah, so what we do in surgery is literally get your torn ligaments and sew it back onto the socket. But what we've done there is we've mechanically brought the two bits back together again. You need a period of time for those to actually biologically heal. Because if they're just held on with stitches and he has another knock and a big bash on the pitch, those stitches will just tear. But if it's biologically healed, it not only will have much better strength, but also will have that ability to heal little knocks and injuries that you're going to get in every game. And then the other thing, obviously, is that he's going to have a massive muscular injury as well with this. The shoulder coming out of socket damages all of the posterior cuff muscles, and sometimes even the deltoid as well. So he's going to have to regain strength, because these little tears in the ligaments don't really impart a great deal of strength. It's those massive muscles that these rugby players have that support the shoulder. So they need to regain strength, and it can take them many months to do that, because you're protecting that shoulder early on from your repair, and then needing to build it up after that.
Brilliant. Professor Peach, thank you very much indeed for speaking to me today.
Good to speak to you.